Good morning, everyone. And my name is Phil Scott. I'm Governor of Vermont, and I want to thank you for joining us for the Public Health and Disaster Response Task Force session on Reimagining Disaster Preparedness and Recovery. I have the very good fortune of co-chairing this task force with Governor Green from Hawaii. Not only is Josh a doctor, as we all know, but he also brings that expertise along with him on the health side. But he also has had to manage a significant natural disaster in his role as governor. We've had our share of challenges in Vermont as well, but the fact is, in this day and age, if they haven't already, every single governor is going to experience some sort of significant emergency, and it feels like they're increasing in frequency. So I want to thank all of you for joining today's discussion as well. No matter the situation or emergency, governors know we need to be prepared in our states and prepared to lead as well, because you never know when the next anvil is going to fall from the sky, and it seems as though they do every single day. As many of you know, this past July, Vermont received multiple days, about 12 in total, of torrential rain from different storms. They weren't all connected to one storm. There was a series of storms which caused severe flooding and landslides throughout the state. For us, this was the second 100-year storm in 12 years. It's important to know most of all the infrastructure projects put in place after the storm in 2011, I was lieutenant governor at the time, helped protect many parts of the state in this past storm. But unfortunately, the latest flooding impacted many more homes, including some in the most economically challenged areas and neighborhoods and communities, one of them being my hometown, as well as many small businesses. So it takes its toll emotionally, and that's also something we need to be prepared for as governors. We're fortunate that Vermonters are always willing to help their neighbors. I think that's part of our DNA, even those they don't know or even like, for that matter. We saw this time and time again as people mucked out basements, cleared debris, dried out their homes, and so much more. We also received a very quick response from President Biden, Secretaries Mayorkas and Buttigieg, as well as Administrator Criswell, and the support of many, many governors who reached out to offer assistance in any way they could, which was all very, very helpful. I'm proud of the work my team accomplished by working together, breaking down the silos, the barriers in terms of even our own agencies and departments. But we also saw firsthand that there's much more work to do. We can all learn from this, improve programs and processes, close the gaps between what victims need and what the state and federal governments can realistically provide. And it's that realism that is sometimes in short supply, and I certainly understand that. And we work to make communities more resilient for the next emergency. That's what we need to continue to keep our eye on. We need recovery programs to be more flexible, to get to people faster. That's job number one. For example, one of Vermont's biggest challenges is housing. We face a housing crisis at this point in time. And this summer's flooding only made it worse, much worse, on top of the pandemic before that. And I know Governor Green is experiencing this in Hawaii as well. And this put a bright light on gaps in the housing programs available in emergencies. So we'll talk more about this today, as well as what we can do to improve data sharing in order to more quickly help those impacted by these disasters. So again, I thank you all for being here. We look forward to the panel, and now I'd like to turn it over to Governor Green.
Aloha. Thank you, Governor Scott. It's good to see you. There's so much to say. First of all, if people aren't in this room and they're at some other conversation, they're making a mistake, because obviously Gretchen and Gavin are sexy as heck, but this is where the action is as far as states and history goes. We just saw Well, first, we've seen tragedies hit us. And so Governor Scott and I have had to deal, as all governors will in some capacity, with major disasters. We don't take them lightly. It resonates with me as a healthcare person in one way, but it resonates with all of us as people. We lost 101 loved ones in Maui with the fire recently. And if people in their municipalities, whether it's local government, county government, state government, federal government, aren't preparing for a large natural disaster, they're condemning their people to a very long road of recovery and a lot of pain. And it's our job probably to be the messengers on this, along with some of our other colleagues who have done a great job with their disasters. August 8th was a day that will plague us forever in Maui, in Hawaii. It was the largest natural disaster we've ever had, one of the largest natural disasters that America's ever had. So let me just share with you what happened. Well, first off, we came out of COVID not long before that, right? And all attention was on COVID for several years, resources, political discussions. Interestingly, Phil and I, our states had the, thank God, the best responses in the country. We had the lowest mortality rate, lowest transmission rates. And it was a testimony to what we were capable of doing in relatively isolated states, but, kind of tracking the virus down every single day. But that meant that we were occupied beyond. My team, terrific. We were as lieutenant governor. We're just going day by day over that. So a lot of, I think, policy didn't focus on other emerging challenges in the world. So we came out of COVID, survived, had about 80% fewer fatalities. But then the fire occurred on August 8th. So early morning fire spread to other parts of the state. We, like every other rural state, has limited capacity, so the firefighters went to other places. Now we had a hurricane, as Phil said, he had these two superstorms in 12 years that were supposed to be storms you only see every 100 years. Well, okay, so we had one too that day. So 74-mile-per-hour winds kept helicopters out of the air. The firefighters went to 3 other fires on Maui and one other major fire on the Big Island, separate county far away. But the winds were so high, helicopters couldn't come in. The fire then kind of burst out again near Maui, near Lahaina, and the cinders went spreading with those winds down a corridor of land that was dense with grasses that hadn't been pared down for decades. I'm just being utterly blunt. And a fire going that fast overwhelmed a town. Telecommunications, and I'm so grateful that we have leaders from telecom, that we have leaders from FEMA who've been fantastic, and resources are finite, just pushed right through. Burned and melted fire trucks along the way, took down poles that just couldn't be moved. And so that's why we had the fatalities. And so we know that we have to prepare for the future. That's what every state has to do. So I'm grateful to the people that responded. I'm grateful that it wasn't 2,000 fatalities, honestly. And we're going to heal where we can. But what I'm here to say is the preparation has to be real. It can't be bullshit preparation, okay, that we sometimes talk about, and then we spend 12 years studying, and then we put out a plan, and then we forget where the plan is on which shelf, and then we come to it again. So we're going to prepare a going forward mechanism to have resources, a dedicated environmental impact fee, call it what you will, disaster fee, a disaster insurance plan. It will help in many ways to help people get ahead with resources, to pre-place fire trucks, to have fully funded resources, to have the ability to bring in a team of mental health care workers before the next dawn if you need. Anyone who doesn't do this is going to find themselves on the experiential side that we are in right now, which is spending the next several years trying to heal after losing land, which came after losing people. So I know that's all very cheerful, and I wanted just to have that real moment with you because I think that local agencies have to know that this is what has to happen. The good news is it is truly nonpartisan. This is a disaster state that will hit blue states and red states and other countries. It is a a necessary way to address the future for our country and has nothing to do with politics. And I will tell you that, quite frankly, we had every visitor under the sun. We, of course, had the president and the first lady, and we also had former Speaker of the House and his whole team of freedom fighters, or I don't know what those dudes are called, and we had a bunch of liberals, okay? And everyone came together and saw what goes on in Hawaii, in this beautiful place that all of you honeymooned at, right? Okay? So that's where we are now. And we're grateful to be able to tell our stories and bring people together, but we have experts today. So I'm grateful to them, and I think I get to, is it correct, Chair, to introduce our first speaker, Colt. Where's Colt? Oh, yes. Okay, Colt, Assistant Administrator of the Recovery Directorate within the Office of Response and Recovery of the Federal Emergency Management Agency, which should have an acronym which is 12 letters long. But at FEMA, Colt's leading a workforce of a lot of people, and I do want to say FEMA has done incredible work. The President gave us the emergency declaration by the next morning, 6 hours in. We are so grateful for FEMA. We complain about them because everyone complains about everybody, but we don't really complain in the sense that we don't think they're doing what they need to do. We complain because we are hurting and everyone's hurting and recovery can't go fast enough. So we appreciate you and the assistance programs that you've brought to us. They put people into hotels. They placed 8,000 individuals that were displaced into hotels completely out of shelters in 13 days. No one ever has done that before. And now we're into the next phases of need. So if you don't mind, Colt, I'd like to turn over to you to tell us how we can solve some of these problems.
Well, thank you, Governor, and Governor Scott. Thank you so much for having us today. Appreciations to the NGA for hosting this panel and for inviting me to speak. Very much appreciate it. I'm going to try to cover a lot very quickly, and so I'm not going to do justice to it, but I'll say that emergency management, to Governor Green's point, it's serious business. Disasters are bad. Please don't mistake my passion for excitement about disasters. This is just what we do. And so we are making a lot of progress in emergency management, and I want to share some of that with you, and it may come across that I'm excited about it. Obviously, this is a tough subject. It's never good when we're involved, and so I just wanted to put that up front. So I thought I'd start very broad and then zoom in very quickly. So go to the next slide. Just what is emergency management? Well, historically, emergency management has come sort of from two different places, and it's converged over the last couple of decades. If you remember back from the civil defense days, from the Cold War, we had a mission of preparing the nation for nation-state type threats. That waned in the 80s, and we really took a lot of lead from the fire service and expansive natural hazards and sort of imbued that into emergency management. Over time, that balance has shifted back and forth, and if you've heard the administrator speak recently, we're doing a lot more emphasis on continuity planning and some of those historic civil defense responsibilities. But if you look at many of the state's emergency management programs, if you look at their seals, their emblems, a lot of them still have the civil defense triangles in there because that's an origin and a basis of some of the principles of effective emergency management. So the diagram you see behind me and in front of you is really the phases of emergency management as they traditionally exist. There are typically four. We are preparing, we are mitigating, that means reducing the risk of disaster or loss, responding, or recovering. This is a little fake, right? In today's environment where we are declaring a disaster just about every 3 days and we are constantly in recovery, it seems as though the next disaster comes before we finish recovering from the last one. So these are all blurred. We do a lot of mitigation and preparedness in the recovery context. And so this is just an example of sort of the discrete elements that go into effective emergency management. The other thing I'll mention is that we talk a lot about resilience. Resilience is not a phase of emergency management, it's a layer of it, something that we try to achieve throughout the entirety of the emergency management paradigm. And so something that we talk a lot about. We want to achieve resilience. We want to decrease the risk of future impacts. And so that's really just the framework of the academia of emergency management. How it's administered in this country is really as an execution of the police power. So a power reserved to the states, to the governors under the 10th Amendment. For that reason, the federal government, FEMA, and the other programs, we're there in support of the governors. And so for that reason, the NGA and the governors, you're our chief partners. We are there in support of you to execute our programs in support of your objectives. And so in that way, all of our programs are supplementary to those of state and local government. And we bring together partners from other agencies, from non-governmental organizations, from volunteer organizations, from philanthropic organizations, and we try to achieve the outcomes that the governors and local elected officials have set. And we have a number of programs that do that, but just to zoom out, to zoom back in, we are there to support the states. Next slide, please. This is a little messed up, but you get the idea. This is how we are organized within FEMA. We're an organization of roughly 22,000 people. Almost half of those work in my part of the organization in recovery and what we are doing after a disaster happens. And we're really trying to focus on, again, delivering those outcomes. Other programs that we administer within FEMA, the U.S. Fire Administration, that's intended to reduce the risk and loss from fires across the country. Resilience, that's where a lot of our pre-disaster activities live. But again, resilience is not a phase, it's a layer. Office of Response and Recovery, that's where I sit, my programs sit. Mission support, that enables all the rest. And then the regions, and this is really key. There are 10 regions, 10 FEMA regions. They align with the regions of a lot of other federal agencies, but not all of them. And each one is headed by a senior executive, well, two senior executives, a regional administrator and a deputy, and they are principally responsible for building relationships with governors and state directors and ensuring that before disasters, during disasters, and after disasters, we have those relationships in place to be able to support them. Emergency management is all about relationships. We can bring together people, we can bring together resources, but it's the relationships that make the difference in the outcomes. So we have 10 different regions, and each one is working every day to build those relationships and to make sure that expectations and capabilities are understood so that we can provide supplemental support whenever and wherever it's needed. Next slide. Next slide, please. Well, on the next slide, I'm going to talk to you about some of the resources that we have available. And of course, the primary access point from that for those are the regions. However, we also have headquarters components that the Intergovernmental Affairs Organization that can provide additional support. You're also welcome to reach out to us at headquarters. We're also happy to talk with you, discuss your challenges, talk about your objectives and how we might be able to support. Each of our programs has different policies and guides in place. These three programs are ones that I'm responsible for. And I just wanted to highlight these ones because they're the ones that you'll probably see most after a disaster. Public assistance, this is help to communities. This is fire and EMS reimbursement. It's repairing schools. It's providing temporary schools like the one the governor in Hawaii is going to open here very shortly. It's rebuilding courthouses. It's all of those types of activities. The second is individual assistance. That's help to families and individuals that are displaced by a disaster or have a loss associated with a disaster. It's not a replacement for insurance. It's a safety net for those who are underinsured or have no insurance or cannot afford insurance. It's something that's a springboard to help them get into recovery. I think it's important to note that when aspects of our communities, when certain populations do not have an capacity to recover individually, that has a impact on the community overall, has an impact on other social service organizations, has an impact on the economy. There's a lot of impacts. And so getting to that grassroots level and helping each family at an individual level is really critical and something we endeavor to do in each disaster. And then the last one, long-term recovery. This is where our programs come up short. And we have to bring in the support from our other federal agencies, our nonprofit partners, philanthropic organizations. They're really working across the federal and non-federal family to bring together whatever resources we can find to support a disaster. I will tell you that it's a bureaucracy. It's complicated. There's a lot of different programs. There's a lot of different applications. It's burdensome. This organization is committed to trying to reduce that burden wherever we can, streamline things, and focus on outcomes, not on programs. Next slide, please. So a couple of our priorities. individual assistance reform. This is that program that's helping individuals and families. Our regulations are over 20 years old for that program and are not keeping up with the times. We've learned a lot since then. We've learned that folks struggle with our programs. We've learned that folks struggle to get assistance and to navigate things. And so we are taking away a lot of that challenge, I think, in our reforms that will be coming out next month, and also providing additional assistance that previously was sprinkled in here or there. We're baking it in now so that it's available in every disaster. We'll do a new public assistance guide this year. As also, we'll be putting out a number of other policies. A lot of those changes are focused on resilience. It's an understanding that if we aren't mitigating while we're going through recovery, if we aren't investing in our infrastructure in a way that's more resilient, we're leaving ourselves vulnerable in the future. We're leaving our communities vulnerable, and we're leaving the federal taxpayer vulnerable. So we want to build back as best we can. So we're coming out with numerous new policies to help states and communities do that more cost effectively and at lower cost to them. And then the last one is we'll be improving the long-term recovery process. There's a thing called the National Disaster Recovery Framework. It's a paradigm for how the federal government supports states and locals in a time of need in an integrated and coordinated way. We're going to rewrite it. We're going to expand it so that it's more representative of all the community members that have a stake in long-term recovery, and also in an effort to reduce some of the, you have to go through so many different agencies in an uncoordinated way, and it's burdensome. And some of the best practices, number one, reach out to your regional administrator. They are your friend. They often advocate on a state's behalf with headquarters. My role as a national level is to try to provide consistent, fair treatment through our programs across the entire country. They are much more attuned to the specific challenges in each disaster, and so they are often advocating on a state's behalf for a waiver or for some flexibility, something like that. So they're good friends, and they'll be working directly with your state directors on an almost weekly, if not more common basis to try to coordinate what you need. I talked a little bit about building relationships more broadly, but with more specificity. Each state has a voluntary organization active in disaster organization. I sit on the national board. These are incredible people. Everywhere I go, I travel a lot and visit disasters. Everywhere I go, I see volunteers coming out of the woodwork. Many times they're organized, sometimes it's organic, but the spirit of altruism in this country is alive. It's just not it's not the same as it used to be. And so coordinating with your VOADs before disaster and then after disaster is really critical. And I think that something that could really benefit them as well. And then develop a disaster housing plan. I think we'll probably talk about housing more, but in all of emergency management is a tough business. In all of it, I think housing is the hardest part. I've never gone to a disaster and said, oh, thank goodness there was all that excess affordable housing around. That just doesn't exist. And so having a plan for how to help displaced individuals stay in their community and stay connected is critical. And then, of course, mitigation. Always try to think mitigation first. Try to think, because we're always in such a rush, like everybody wants to get back to normal as fast as possible. Taking a minute to pause and think about what you want it to be and how it can be better. There's many resources available to that if we just take the time. And so that's a summary of, overview of our programs, and I'll be happy to answer questions at the end. Thank you.
Thank you, Colt. Yeah, it's excellent what Colt just shared. The to kind of layer our experience over that just very quickly. Like I mentioned, they were successful in putting 8,000 people into hotel rooms. 60% of those people are still there. 40% though are now into long-term housing. So it takes time. It is very challenging in every market. Hawaii, of course, we have very constrained housing because we are a tourist destination. Beyond anyone else probably. And to the point that Colt made, the volunteers were amazing. We had over 500 volunteers at any given time from American Red Cross and over 500 FEMA officials and government officials, so 1,000 people on a site. They built a school in 95 days. It's just shocking. $45 million. And they're removing the debris now with the Army Corps of Engineers, which is a project that will take 6 to 9 months. But think about that. No small state or no state probably could do that themselves. It's $1.2 billion, which is why there's huge cost sharing and why they are expert in what they do. But the housing component, as he stated, is challenging. And one of the benefits of being here with my colleague and with so many others is after meetings with all of the executives, I'm learning on the fly too, and I'm going to get home and order 2,000 houses be built, and we will find a way to catch up together. It can't all be the responsibility of FEMA, but it can't be all the responsibility of a state either. And so if we learn from some of our predecessors who are telling us that 4 years in they're still wrestling with when they get their HUD money and when they are ready to deploy that to help their people, we probably just get to learn now and expand. Yes.
Yeah, I might put we'll go off script here a little bit.
Yes.
Finer point on that in Vermont, we're very mountainous, and some of the impacted homes were in the most economically challenged areas, as I said before, mobile home communities in particular. And when you think about the back-to-back type of flooding that we had, some of these folks were impacted for the second time in a matter of 12 years because of the low-lying areas. They're in floodways. Well, FEMA inappropriately wants to make sure you have flood insurance if you take advantage of the program and get any distribution. Well, they took the distribution, but some of these folks didn't have any money for flood insurance, so they were not eligible for the second round. So that's one of the challenges we face, and particularly I am sensitive to the mobile home communities because again, they don't have any. It's the elderly, usually the elderly in retirement homes, or those who just can't afford anything else. So I think housing, as you stated, is probably the most difficult aspect of this in the long term, and something that we need to work on.
And just to underscore that point, in Hawaii, mobile homes aren't legal. So I'm not saying there aren't any mobile homes, but that was not a part of the arrows in the quiver of response, even though maybe it would have helped us, but it's not really who we are. And if we did that, we're changing who we are. So extraordinary challenges, because one size does not fit all, but we can prepare. So now we next get to go to another expert. I get to introduce Dr. Miriam Delphin-Rittmon. Thank you,
Yes.
Doc. Good to see you again. And Miriam's the Assistant Secretary for Mental Health for SAMHSA, basically, right? And so this is a critical space for us in recovery because the trauma that occurs, not just physical trauma, of course, but actually psychological and emotional trauma is profound. And so in this role, she's central to what we can do to recover. Previously serving as commissioner of the Connecticut Department of Mental Health and Addiction Services for 6 years, it's just the right progression for an executive for us. So we're so grateful for you, and we turn the floor over to you, Doc.
Thank you so much, and good morning, Governor Green and Governor Scott. Really appreciate the opportunity to be here with my fellow panelists and with everyone who's joined us today. I have a number of slides that I'm going to go through quickly as well, and then really looking forward to the questions and discussion and hearing from you all in terms of thoughts or questions that you have. Next slide. I wanted to start by, in terms of quick overview, we'll talk a little bit about some of the impacts, the behavioral health impacts of disasters. We know that the behavioral health impacts can be far-reaching across the lifespan, so we'll talk a little bit about that. We'll talk a bit about SAMHSA's disaster response framework. Colt mentioned this already. Many of these phases sort of are in operation simultaneously in many instances. And sometimes at the preparation plan stage, it's often important to be thinking about mitigation and recovery. And so we'll talk a bit about that and some of the SAMHSA programs and resources that are available there. And then we'll end with some of the technical assistance and grants and other resources we have that are available as well. Next slide. So in terms of the behavioral health impacts, we know that they're far-reaching. They can be far-reaching. In addition to some of the physical changes that can happen as a function of the disaster, often we see a tremendous amount of loss. And that loss can impact people in terms of increasing feelings of anxiety or feelings of depression or people's sense of safety or sense of home. In some instances, it's loss of land or loss of culture as well, depending upon the level and what the nature of the disaster. And those things have impacts in terms of people's overall well-being and overall mental health. Disasters, we know, also can impact social determinants of health. So things like housing, transportation, education. Kids may not be able to go to school. And we know kids connect with other kids. That's an important part of their overall social emotional development and well-being. All of that can be impacted in a disaster situation. And so planning and sort of mitigating and thinking about ways to intervene and impact some of those areas are really critical. We know that there are also particular populations that may be impacted. Sometimes first responders, we know, are there from the beginning, and that may be a particular group to pay attention to. Again, children or family members or individuals that have lost family members. And so there are particular groups that may be particularly at risk that's important to pay attention to, in addition to, the full population that's experienced the disaster. Next slide, please. So at SAMHSA, we have a disaster technical assistance center. And the Technical Assistance Center really is about sort of meeting states sort of where they are. We will come on site. Our aim and our interest is to be able to sort of be there and to work with states and to be able to assist in terms of any of the needs that come up in terms of planning. Planning in terms of addressing the behavioral health needs as a function of the disaster. One thing that our Disaster Technical Assistance Center recommends is that the behavioral health disaster plan, that it aligns and it is in sync with the overall incident management plan. And that can be so important to have those two sort of working in tandem and working sort of in a congruent way. There are 8 sort of key components that it's important to consider. I won't go through all of them, but it includes things like scalability, needing to plan for and think ahead around the numbers of individuals that may be impacted and the numbers, for example, of individuals that may need services or supports, whether it be, mental health services or in some instances, substance use services. Often in disasters, we see an uptick in use of substances, and sometimes people may be using the substances as a way to cope. So thinking about scalability and being able to have services and supports in place to meet the potential emerging needs. Also thinking about offering a range of services and supports, across the behavioral health spectrum. So not necessarily just mental health services, but also in some instances substance use services. Thinking about lifespan. Are there particular services that may be needed for elderly individuals who may be isolated or who may be displaced and may have additional health needs in addition to what they're experiencing as a function of the disaster? Or are there particular services that are needed for children? Because so much of their world has been changed or can be changed within a disaster situation. And so thinking about the range of services that are needed is critical as well. You'll see some of the other areas there, and I invite you, please check out our Disaster Technical Assistance Center, because it goes through this content as well as a number of other resources that can be helpful in terms of disaster preparation and planning. Next slide, please. I did want to talk about some of the grant and funding opportunities that we have. We are so thrilled to be able to partner with FEMA on our crisis counseling grant. We call it our CCP. This is a grant that is available when the president declares an emergency. State of emergency. And once that's declared, it sort of activates this grant, again, the FEMA and SAMHSA, and again, SAMHSA stands for the Substance Abuse and Mental Health Services Administration, that we collaborate on to be able to offer immediate resources so that there can be an immediate behavioral health response. So there's one initial level of the grant. It can be applied for within the first 14 days. And again, we have a disaster behavioral health coordinator who can work directly with the local state teams and the governor's teams around sort of thinking through what ways can those resources be used and what can be proposed or ought to be proposed to address some of the needs that are beginning to emerge. And then there's a second level of that grant, which is a services grant, and that can be applied for within 60 days as well, or 60 days. What we found in 2023, increasingly we're seeing a range of disasters, and these disasters can be applied for, whether it's a natural disaster, community violence. Really, it's quite broad. In 2023, we offered about 80 million, and 41 emergency grants were awarded across the country. We found about 230,000 individuals were connected to behavioral health services and supports. So it speaks to just the level and the range of need that people experience going through a disaster. And then about 1 million individuals received training and education around what to recognize, how to respond if it's apparent that a family member, a friend, or a colleague, or a first responder is struggling. And that piece is so important, being able to sort of recognize the signs that an individual may need assistance, so we can provide support there as well. Next slide, please. The other grant that I wanted to share about, and this is a larger grant that can be applied for whether or not a state of emergency is offered. And these funds really help with broader infrastructure and broader, more long-term behavioral health assistance and support. When I say behavioral health, it's in terms of both mental health and any substance use needs that may be arising and that the area wants to address. And so again, just a few recent examples, worked real closely with each of the teams in terms of the Maui wildfires, Ohio train derailment, mass violence situations in Maine. And often what we do, we are really here to work with the teams that are going through these profoundly challenging situations. And we will bring a team on site. When there's so much going on, it can be sometimes hard to even think through, what do I need? How do I conceptualize this grant? How do I put it together? How do I think about timeline? How do I think about staffing? We'll bring a team on site to work with your team around putting together, what makes sense, what will work both short-term, intermediate, and long-term with these funding resources. Next slide, please. The other resource I wanted to share about is our National Child Traumatic Stress Network. And so this is an initiative that it is a vast network of providers across the country, over 10,000 partnerships, about 200 centers. And what this offers is training, technical assistance, resources to address the trauma and behavioral health challenges that children and families may experience as a function of a disaster. In FY23, about $90 million was awarded to address sort of community treatment and service centers as well. And so wanted to remind folks of this grant award as well. There is a website that has just a wealth of resources that is available that can be used on the ground, can be used at local counseling centers, can be used within school settings, within community settings. And so this has been a really valuable resource for us throughout traumatic and crisis situations. Next slide, please. And then a couple of resources I wanted to leave you with. Again, so I mentioned our Disaster Technical Assistance Center. And so what that is it's a technical assistance center that has just a range of evidence-based resources available for behavioral health providers, for community members to help address both sort of pre-disaster planning as well as post-disaster sort of needs and areas. We can offer and offer webinars, training, tip sheets, and individual guidance as well if that's necessary. Next slide. And then the last resource I wanted to share is our Disaster Distress Helpline. So this is a helpline that is available 24 hours a day, 7 days a week for individuals, community members, really across the state that's experienced a disaster. We get quite a bit of volume that comes in and when a disaster happens. And really that is the goal, really meeting people, letting folks know that if they are struggling as a function of whatever the disaster is, there is somebody that they can call and connect with by phone to get assistance. And there's also an opportunity then to be connected to other more long-term or shorter-term, whatever the needs may be, services and supports. And you'll see some of the metrics there in terms of just the number of calls, texts, and chats that have come in, and then the numbers of individuals that have been participated in sort of crisis training and crisis counseling related to the Disaster Distress Helpline. Next slide. And so again, appreciate the opportunity to be here. Looking forward to our questions and discussion. We love these QR codes, but I did want to say also, check out our website. It is grant season, and so there are a number of grants that are coming up. We also have the 988 Suicide Crisis Lifeline toolkit that has resources that are available for disaster situations as well as others. So thank you.
Thank you very much. Thanks, Dr. So a key point is prepare early before the disaster strikes, and look to these grants beforehand, so you have resources in place, and because it's chaos once the disaster occurs. So it's a good chance if you have some of your departments, taking a look at this, because by the time the fires occurred or the floods occurred, people are so traumatized that they barely can see straight, right? So my strong recommendation would be to do that early on. We're going to move now to our third speaker, Jennifer Enderlin, and Jennifer is the Director of Corporate Responsibility at AT&T. It's very important to note the amount of resources that are necessary for communications, and communication tools are your lifeline during the crises. In fact, they were also one of our greatest challenges. The reality of the fire was it took down all communications essentially. So people had to go into the fire zone. We couldn't even get any warnings out after a certain amount of destruction had occurred. So I'm really interested in hearing what one of our national leaders, if not our top national leader in telecom, offers. Jennifer's also on the board of the SBP, which is a nonprofit disaster relief organization originated after Katrina. A lot of the lessons we've had have come out of Katrina, and a lot of the consultants and excellent professionals that we're using now touched that disaster, touched many of the disasters. There's a cohort out there that are amping their experience each time. So we'll turn to you as a advocate and executive.
Thank you. Thank you for the invitation to be here. Today I'm going to talk about how AT&T supports communities before, during, and after disaster events. Before disasters, we believe it's important that companies and leaders understand how they can better protect critical infrastructure and vulnerable populations. That's why, next slide please. That's why at AT&T we've invested heavily in the resiliency of our network over the past few years by working with the U.S. Department of Energy's Argonne National Labs to develop a new online tool to help us visualize climate projections such as wind, drought, wildfire, and flooding at the neighborhood level up to 30 years into the future for the continental United States. This new tool, the Climate Risk and Resiliency Portal, we call it CLIMER, helps us make informed decisions as we plan for network build-out, maintenance, and disaster preparedness. This data not only makes our business more resilient, but we, along with Argonne and FEMA, have created free, easy access to this tool for the public, helping to improve America's preparedness for future climate extremes. Last summer, AT&T and the Idaho Office of Emergency Management collaborated to incorporate CLIMER's forward-looking data into their new hazard mitigation plan that was submitted to FEMA for review. States who want to leverage this new tool for your plans can reach out to me and I'll connect you to the expert at AT&T. Next slide, please. Then during disaster, looks like my slide is gone. During disasters, AT&T's commitment to communities is truly evident. Preparedness and recovery are so important to what we do. We have an entire business unit dedicated to it. The mission of AT&T's Network Disaster Recovery Team is to quickly recover the network in impacted areas, resulting in rapid restoration for our customers and public safety on FirstNet. As you could see in the slide, if you could see the slide, AT&T's program includes a fleet of more than 400 specialized response assets that are housed in 5 warehouses across the U.S., which are prepared to be deployed as needed. We've invested more than $1.1 billion in our program since it was launched in 1992. It's extremely important to AT&T. Then after disasters, while our business is recovering the network and we're internally helping employees recover who may have been impacted through our Employee Relief Fund, we also support 2 nonprofit organizations, national organizations, who help meet the needs of communities. The first is ITDRC, Information Technology Disaster Resource Center. They're based in Fort Worth. Their mission is to provide temporary communications and technical resources, including radios, Wi-Fi, satellite, telephone, and charging solutions to communities after disasters with a focus on public safety, mass sheltering, and community recovery. They are a VOAD partner. They have leadership and resources in 10 regions that align with FEMA and more than 4,300 registered volunteers across the country. We lean heavily on this group to help fulfill requests for stakeholders, from stakeholders for connectivity and charging solutions. During the wildfires on Maui, they were quick to respond, flying in teams and equipment to stand up connectivity in shelters, implemented an asset tracking solution for public safety, in addition to pallets of resources with charging cables, battery packs, and things to help folks stay connected to their loved ones. In Vermont, they deployed after the floods as well and are still providing support to 2 long-term recovery organizations in Bar City. And finally, this year, ITDRC is launching the AT&T Mobile Connectivity Center. This is a mobile trailer with computers and connectivity that can be used as a command center when disasters strike, or rolled up to shelters to help survivors start the recovery process. They're a top-notch group. The second nonprofit that we support is SBP, an organization with the mission of reducing the time between disaster and recovery. I serve on the board. I'm joined here by Reese May, who's Chief Strategy and Innovation Officer, and he was recently selected for FEMA's Vanguard Executive Crisis Leaders Fellowship. SBP has been rebuilding around the country since Katrina. To say they are deeply committed is an understatement. Through years of rebuilding, they've developed the expertise to help inspire much-needed systems change through 2 innovative programs that Reese will talk about today.
Well, thank you, governors and GA, for the opportunity, and Jen for the introduction. I'd start by saying I wanted to agree strongly with everything you were saying. I thought my head might fall off my shoulders if I did that, though. I'm from that Katrina cohort. I'm from Mississippi, from the Katrina-affected part of Mississippi. I helped to lead SBP, the nonprofit that Jen mentioned. We began as an organization rebuilding homes for disaster survivors who owned their homes, couldn't afford other homes, desperately needed to get back to the affordable homes that they already own. So when you hear about the additional stress that disasters are causing on already unavailable affordable housing in communities, I want to assure you that it's not a Vermont or Hawaii problem. I can tell you from 13 years of my own personal experience, it's a Texas problem and a New York problem and a South Carolina problem and a West Virginia problem, and soon, as the intensity and frequency of events continue to increase, it'll be a problem every single place that you can think of. As a nonprofit, people-serving organization, I don't want to cure more ailments after disaster, and so I'm very eager to think about how we cause the innovation and changes necessary to generate greater speed and flexibility and truly more equitable distribution of the programs that Colt mentioned, the delayed HUD resources that Governor Green has mentioned. And so I would share today just a couple of SBP's programs. One, before disasters, that should help small to medium-sized communities access many of the newly available mitigation and resilience resources. If you look back over the last few years, FEMA's put out a few $1 billion, and Colt, this is with all due respect, to the BRIC program, and those monies tend to go to major metropolitan areas, communities that have the capacity to measure their disaster risk and submit sophisticated applications to receive hundreds of millions of dollars in resources to execute those projects. Small to medium-sized communities do not stand a chance of putting together competitive applications, and we think that's really a disadvantage because so many Americans live and work in small to medium-sized communities. So one of SBP's disaster preparedness initiatives, and I'm really thankful I see Kevin out there from Walmart, but I'm so thankful to the Walmart Foundation. Walmart's going to allow SBP to place fellows in 12 different small to medium-sized cities, and Colt, you'll be thrilled to know they're CEDARS designated zones, so the community disaster resilience zones that FEMA recently designated high-risk areas all around the country. SBP is going to put personnel there to help them get access to these resources. So many organizations have published how-to manuals and resource guides, but we think the real missing component is a piece of human infrastructure, a set of hands whose only responsibility is to think about disaster risk in this community and what resources we could get our hands on to mitigate it. So I'd love to talk more about that with anyone who's interested after. After disaster, we realized the real urgent necessity of innovation. As Governor Green mentioned, it often takes 3, sometimes 4 years for HUD dollars to make it from congressional appropriation to HUD allocation to Federal Register notice to actual usable cash in the hands of state governments. But the people who are displaced in Rutland and Washington counties and in Lahaina, the people who need their homes to be rebuilt right now, we know who they are today. We know that they own their home. We know that they don't own any other homes. We know they can't afford market rate contractors, and without some intervention, they will wait and receive the paltriest amount of assistance that comes last in line years from now. We can identify those people now. Why can't we rebuild for them? In Louisiana, SBP made loans to a couple dozen families after Hurricane Ida, and we were able to return those families home years faster than the state recovery program is able to make it to scale. We plan to replicate that program in Florida. Our first welcome home party is going to be next week, so stay tuned for that. But there are obvious opportunities to do this in disaster-impacted communities all around the country. If we know who needs help now, there is all the capital in the world to pull off the sidelines and help these people today get home to the homes they already own, use federal assistance to reimburse those repairs or those loans in the future. This is sort of experimental work that SBP is on the very leading edge of, and we look forward to talking more and learning more from all of you.
So we thank you guys. Thank you, Jennifer. Thank you, Reese. You're seeing a very broad perspective today, and that's one of our goals. I'm going to turn this now back over to Governor Scott, and he'll lead us in questions. We only have about 10 minutes left, so I'm probably going to go rapid fire, but it's just a lot of lessons here, which I'm appreciative of.
Well, again, we have about 10 minutes left, so I'm going to forego my question. I'd like to hear if there's any questions from you out there, maybe a couple of comments. So first, in Vermont, during this understanding the turmoil and the emotional needs of people when they experience this is real. And I think it's incumbent upon governments to be prepared. So when we're talking about our emergency preparedness plans and so forth, it's up to us to give them the confidence that we've got this. Like, that's what they want to hear. They want to know that somebody is there for them. So that's why FEMA is important, and all the federal entities are important, but us as well, as governors. We had a continuity of operations plan put together that our former Secretary of Administration forced us to do. We thought, why would we ever need to know where we're going to set up? We're not going to have an emergency like that. Well, this flooding hit the state capitol. We were down. I'm still not in my office in Montpelier. We're working off-site. But the very next day, we had a continuity of operations plan. We were back in business the very next morning. Nobody knew that we were displaced. Our emergency operations center was impacted, so they had to relocate. So there's all these things that, sometimes we scoff at over preparing, but it's real, and we owe it to our citizens to be prepared, because it gives them that confidence that we're there for them. So, and it's the same with the business world and so forth. So I'd like to open it up to questions from all of you, because you're the most important ones. Yes.
Hi, good morning. Tracy Gruber, Executive Director of the Utah Department of Health and Human Services. Preparing for an emergency keeps me up at night, probably more than anything else. And I just have a question. Well, first, having been to Lahaina and Maui a few times, I think we all watched and mourned with your entire state while that was happening. And we also have a housing shortage. Our department's responsible for ESF 6 and 8. And housing's a big issue, already a housing shortage. I'm just wondering, in a state that's reliant on tourism and lots of rental property and VRBOs and all of that, were there any levers that you pulled in your state to ensure that those properties became available for victims?
Oh, yeah. So we used fear of God on them. So, because we could only do so many things so fast, but fascinating question. So Hawaii's got 89,000 statewide short-term rentals, of which 15,000 are legal. So we have 74,000 non-legal or just illegal Airbnbs, short-term rentals. And that's why we have a housing shortage, among other things, but that is a huge part of it. We also can't build housing fast enough. So it's an incredible challenge. Maui, as you know, Maui's 1/10 of our population, 150,000 out of 1.4 million people. There's 31,090 short-term rentals on Maui. Now, we had 3,000 families displaced out of that population, and we couldn't get people to convert their short-term rentals. Why? Because rent costs $4,000 a month, regular rent, for a 1 to 2 bedroom condo or house in Maui. Guess what you make on a short-term rental? $16,000. Okay, so you make 400%, so 4 times as much. So it's killing us. So what we had to do was a couple things. The mayor took action pretty quickly at our behest, and normally councils and legislatures can't pass things quickly. They did this time, amazingly. In 3 weeks, they passed a bill so that people get tax-free status. They waived property tax. That moved 1,300 out of the 31,000. So it's only 1,300 out of 31,000 took that up. So think about that. That's like 8% took up the opportunity, because getting a tax exemption from property tax might save you 10 grand. But when you're making $200,000 a year, it's just not enough. So I came over the top and I said, I'm going to institute under emergency powers a moratorium on all short-term rentals. And so you know that's not a taking. We will pay the market value of the short-term rental. We'll pay $9,000 or $10,000 a month if necessary for what you made the previous year, and you'll get the tax break. And that has now resulted in 4 or 5. I'm told as of yesterday, 4,000 or 5,000 now available units. So we'll get through a year or two, but big problem because it's going to cause a super ripple effect, right? What's happening is some people, it's just human nature, they're letting other people's leases expire. A few people broke the law and outside of the emergency rules kicked their people out of their rentals to get now into this program. And so regular people who were not affected by the fire are now feeling the effects. And what's going to happen when FEMA no longer, because FEMA's paying that rate, as will we, for non-FEMA eligible people at great cost, $1 million a day, which is going to start dropping as people leave the hotels. What will happen next? Well, the market is changing. So long story short, we have to reform the short-term rental market. I need to move about a third to a half of all short-term rentals into ownership for local families. Another couple facts, just so people know, 52% of all short-term rentals in Hawaii are owned by mainland guys, you guys, my relatives, a lot of people, and 27% of all short-term rental owners own 20 or more units. So it is, in some markets, a human disaster. It just means that housing has to change, housing policy has to change, because otherwise we have to then go to FEMA and beg, borrow, and steal and plead to build a couple thousand houses and still have the same shortage afterwards at very large cost and extreme difficulty. And we still have to build, that was before the fire. We had that shortage, and now you added those 3,000 displaced families. So it's a long answer, I apologize for that, but look to those kind of solutions in advance of your disasters, even if they're hard questions.
Just one addition to that, in Vermont, it was so widespread, it wasn't just one community, unfortunately. It was throughout the state. So it multiplies the challenge because we have so many areas impacted, and finding we have a housing crisis as well. We have a homeless population that we're still housing in hotels and motels from the pandemic. So it's just very challenging. One more question. Yes.
Thank you and good morning. My name is Peter Biava and I work with Miriam Infrastructure. We are an investor in public-private partnerships. I'd love to acknowledge that the capacity to respond to disasters is a great public good. I'm wondering what the good folks on the panel would suggest. What's the responsibility of the private sector, and how can private capital help either increase the capacity of disaster response or make investments up front to lessen the cost or the severity of disasters?
Let the panel weigh in. They are essential. We have relied on a lot of our corporate partners in Vermont, and they've been very giving, and without them, we would be more challenged.
I think that corporate and social responsibility has a significant interest in understanding the risk profile of the communities where its employees and customers live and work, and that I would actively consider any business to consider what risks its communities and its employees are at. The kind of, the fellows program that I mentioned is a way. You can put a person in a community that you care about to better quantify and identify risk mitigation opportunities, but there are other ways as well, whether it's feasibility studies to, meet critical gaps that local municipalities are having in quantifying what they need to do to get after risk, or, realizing that business continuity means making sure all of your employees are able to get back to work and, back into their homes after disaster, and doing educational programs that meet people where they are kind of on the preparedness continuum. But surely business and private sector has an enormous role to play. And I'd love to talk to you, brainstorm some more later if you'd like.
We are out of time, and I wanted to thank everyone for coming here today. The message I would deliver is that we're all in this together, regardless of party, and every state is impacted. The first call I made when I heard about Maine, for instance, our next door neighbor, when they were experiencing flooding, was to Governor Mills, and said, we're there to help you, and we've sent people there to assist them in trying to, navigate their way through the bureaucratic process, because FEMA is wonderful, and we're very thankful for that, but it is bureaucratic and it's difficult to get through. So we've unfortunately become a little bit better at it over the last few years, and it's essential that others, governors, understand that as well, and that we're here as a resource, all of us who have been through this. So that would be my message here. I want to thank the NGA as well for all the good work in putting this together. We should have these more often, I think. Because we're all going to be impacted. Governor Green.
Yes. And the last thing I would say would be achieve balance in your states. And I'm speaking to that corporate question and to the social question and to the government question. Achieve balance in advance. Sounds hocus pocus, it's not. If you don't achieve balance in housing, in preparedness, in advanced resources, and have advanced resources in a revenue stream, if you don't have that balance, you will suffer the consequence, which is, in our case, a $5 billion crisis, 101 lives lost, settlements, and 5 to 10 years of rebuilding ahead, which, as everyone knows, will be extraordinarily challenging from a mental health standpoint, from a housing standpoint, from a services standpoint. So get that balance in place early. Know your FEMA people, know your SBP people, know your ARC, Red Cross people, know the SAMHSA people beforehand, so you're not struggling to catch up. And also have your recovery team in place early, even though you'll be putting resources there, because it will save you a lot of challenges midstream with the disaster. But please achieve that balance, because know that if we don't, we're going to pay a lot more for it later in terms of all resources, human and capital. And thank you guys, and definitely thank you, Governors Association, for letting us wax philosophic on this matter.